Unit 11 Surgery. The surgery section is the largest section in the CPT codebook and is divided into 19 subsections. Most surgery subsections are based on anatomic site, example integumentary or respiratory. Subheadings are further divided into categories of procedure, for example shaving or removal. Guidelines are found at the beginning of each of the 6 CPT codebook sections. The guideline define items that are necessary to interpret and report the service and procedure contained in that section. Coding guidelines. Throughout the CPT codebook are narrative notes. The information on the notes provides special instructions unique to a specific CPT subheading or section. To audit the surgical medical record accurately, the auditor must have a good understanding of surgical terminology and anatomy. The auditor must also understand surgical coding guidelines, insurance rule, and the NCCI edits, which is a National Correct Coding Initiatives. CPT Global Surgery Package. Often, the time, effort, and service rendered when procedure is performed are bundled together to form a surgery package. Payment is made for a package of service and not for each individual service provided within the procedure. The CPT book describes the surgery package as including the following components: the operation itself, local or topical anesthesia, subsequent to the decision for surgery, one E&M encounter that's related to the surgery, immediate post-operative care, evaluating the patient post-anesthesia in the recovery room, writing orders, and typical post-operative follow-up. Global days. Global surgery period are usually 0 to 90 days. It's a period of time after each surgery established by third-party payers. CMS defines global days as 0, 10, and 90 days. All services related to the procedure are included for the defined number of days following surgery. CMS defines the day before and the day after as part of the surgical package. If patient is returned to the OR for related, repeated, or stage procedure, the procedure may be identified with a modifier. Pre-operative visits. Pre-operative period includes any visit by the surgeon in or out of the hospital for 1 day prior to surgery. CMS emphasizes that pre-operative billings are monitored carefully. 2 exceptions for a minor procedure with global days 0 to 10, modifier 25 can be reported with the E&M service if the service goes above and beyond the typical pre-operative care for the procedure, and it must be documented. For a major procedure with a 90-day global period, CMS will allow the E&M service to be billed separately when a decision for surgery is made and the procedure is performed the same day or next day. Modifier 57 is appended to the E&M service code. Complications. Complications following surgery that requires additional medical or surgical service but did not require a return trip to the operating room, Medicare will include these services in the approved amount for the global surgery package. If due to complications, the patient returns to the OR for medically necessary care, modifier 78 will be appended to the surgical code. If the procedure used to describe a service for treatment of complication is the same as the procedure used in the original procedure, modifier 78 is still the correct modifier to use. Post-operative services. Global surgery. Post-operative period of 90 days and includes the following: dressing changes, local incision care, removal of operative packs, removal of cutaneous sutures, staple, lines, wires, tubes, drains, cast and splint, insertion, irrigation, and removal of urinary catheters, routine inspections of peripheral IV lines and nasogastric and rectal tubes, change and removal of tracheostomy tubes, E&M services that are unrelated to the diagnosis, for which the surgery is performed is payable by appending the modifier 22 to the appropriate E&M service code. Minor surgery. Minor surgeries have a global day of 0 or 10 days. A minor surgery does not have any associated preoperative or postoperative work. CMS guidelines determine the duration of a global period. To determine global period for major surgeries, count 1 day immediately before the day of the surgery, and 90 days following the day of the surgery. To determine the global period for minor procedures, count the day of the surgery and the appropriate number of days immediately following the day of the surgery. NCCI. CMS implemented a national policy aimed at controlling improper or incorrect practices in filing Medicare Part B claims. Procedures should be reported with the CPT and/or HCPCS that describe the service performed and in the most comprehensive manner. Unbundling occurs when multiple procedures are billed separately when the services are covered by a single comprehensive code. Results from two problems: unintentional not having a good understanding of coding and intentional manipulating codes to maximize payments. Modifiers. Modifier 59 is used to indicate that a provider performed a distinct procedure or service for a patient on the same day as another procedure or service. The use of this modifier allows a code payer to bypass the NCCI edit and both services will be paid. Modifier 25 is used to allow additional payments for E&M services performed by a provider on the same day as a procedure, as long as the E&M services are significant, separately identifiable, and above and beyond the usual preoperative and postoperative care associated with the procedure. Scope versus open and diagnosis versus therapeutic. Surgical endoscopies include diagnostic endoscopies. Coding is based on the depth reach. Multiple biopsies code only once, whether it's single or multiple. Biopsy and excision performed on different lesion code both and append a modifier. Diagnostics are performed to determine or establish a patient diagnosis. Diagnostic services include performance of the procedure and recovery of the patient after the procedure. Therapeutic services are performed for treatment of a specific diagnosis. These services include performance of the procedure, various incidental elements, and normal follow-up care related to the procedure.